So I hope that it will be included since marami namang pending bills dyan sa Congress with regard to that. Iba-iba ang pangalan, iba-iba ang titles. So sana masali siya.
Senator Bato de la Rosa is again pushing for the death penalty for convicted large-scale drug traffickers.
Advocacy ako talaga yan at alam ko na kailangan yan. Wala silang takot wala silang takot, hindi sila natatakot. Galing na coming from the mouth of the Chinese drug lords sa loob ng Philippines. Diyan na sila matakot pag mamatay sila.
True to his name, this senator is making a push for tough measures. Senator Bato de la Rosa wants the return of the death penalty and mandatory ROTC. He also wants to institutionalize government's controversial anti-insurgency task force. Do these bills have a chance in the 19th Congress? We ask in this episode of The Chiefs. Welcome to The Chiefs. Ako po si Roby Alampay. Kasama ko po dito sa studio si Lingao at kasama rin po natin online from Quezon City, Luchi Cruz-Valdes of News 5. Maya-maya po sasamahan din tayo ni aming Pamintuan. She's at the Philippine Star in the port area in Manila. Chiefs, happy Monday.
Hi guys.
Happy Monday.
Anong balita, Ed? Dahil sa key appointment today from the President Marcos.
Energy. Popolotilla.
Popolotilla.
Yeah, a throwback from GMA's time. So we're seeing a lot of familiar old faces.
And Luchi, ikaw, anong namomonitor mo?
Mas exciting sa labas sa Sri Lanka.
Sri Lanka.
May rollback mamaya.
Malaki yun.
Exciting din yun.
Malaki yun. Very expected.
That's more than 6 pesos. So that's a big deal for a lot of POJ and PUJ and PUB operators. As well as ordinary motorists. Although yun nga lang, we won't feel any effect of that on commodity prices as of yet.
Pagkatapos kanina sa big story, ang pinag-usapan namin, meron ding push from some players in the agriculture sector asking and urging the government to declare a state of emergency
so that they can release their calamity funds. The thing lang with that is that if you release it too early, wala pang mga bagyo. So once the storms come around and once the disasters come around, baka ubos na yung pera. That's the trade-off there.
Well, anyway, maybe these are some things that maybe could come into our conversation with our first guest, but we will start with some of his proposals. Death penalty and institutionalizing the NTF-ELCAC are just some of his current bills. Welcome to the Chiefs, Senator Ronald Bato de la Rosa. Magandang gabi, Senator Bato.
Good evening.
Good evening, Senator.
Roby, Ed, at saka Luchi.
Magandang gabi, sir.
Magandang gabi po. Sir, didiretso na muna ako dito sa proposal nyo na ibalik ang ROTC dahil alam naman ng lahat ng tao si Vice President Sara Duterte nung kampanya pa lang sinabi niya she wants to bring back military service. Ngayon, linawin ko lang po. Yung sa kanya medyo malinaw, military service. And in fact, we could basically call it conscription. Kasi sinabi niya, model niya, South Africa, Israel, doon umaabot ng isa't kalahating taon, 2 taon. In fact, she said, hindi ROTC itong pinag-uusapan natin, ha? That's what she said, hindi ito weekend training. Yung sa inyo po, ROTC, ito yung mga inabutan ni Ed tsaka ni Luchi, na tsaka nung talagang ano lang.
Wala ka naman sa eksena.
Ito yung weekend training lang. And also, I want to ask, is this related to the overall push of Vice President Sara Duterte?
Yes, Roby. Yung nga lang, iba yung version na nabanggit niya. But anyway, yung sa akin naman na ROTC bill is reiteration lang ito sa pinail ko last Congress na ROTC bill na hindi pumasa. So ibabalik ko lang ngayon yung aking ROTC bill.
What makes you think that this time it will pass?
I am hopeful. I am hopeful na makapasa ito ngayon, lalong-lalo na gusto ng may support tayo galing from yung si Vice President, no? Gusto niya ibalik yung ROTC. At ako mismo, with or without the support of anybody from above or outside the Senate, ako mismo, I really feel the need to bring back mandatory ROTC.
Why ba? Bakit ba, Senator? Ano bang napapala dyan ng mga bata, ng mga estudyante na hindi nila nakukuha ngayon? How will it help them and how it help the country in general? No? What good will it bring?
Number one, discipline-wise. Alam natin yung ROTC magbibigay ng disiplina sa ating kabataan at leadership para sa ating mga kabataan at yung ating patriotism among the youth ay madidevelop through ROTC. And ang pinaka-importante dito para sa akin ay yung tayo maliit na bansa. Alam natin meron tayong threat coming from China, dyan sa West Philippine Sea, and kailangan prepared tayo all the time. Just in case aggression happens, yung ating regular armed forces ay napakaliit. Kinakailangan natin ng nasuportahan ito ng reserve force natin. So, anong reserve force natin kung wala tayong ROTC training among the youth? Wala tayong reserve force. Wala tayong maasahan aside sa ating regular force. So, kailangan talaga, worst comes to worst, push comes to shove. Dapat handa tayo as a nation to defend this country at any time.
Sir, qualify lang natin, sir. Yes, sir. Sir, qualify lang natin na ito ho ba ay kagaya nung CMT at C18 nung panahon natin o this is a completely different thing? I asked that kasi although nung panahon namin, tinatawag din siyang ROTC pero hindi siya talaga ROTC eh. Yung mga ROTC talaga noon where yung mga nag-commit talaga to be reserve officers and meron talagang formal training. Kami mga hampas lupa, ano lang kami, mamarcha-marcha lang kami every Saturday at nagpo-formation.
It was just the training.
Yeah, dagdag ko na rin dyan, sir. Kasi nung panahon yun, at least nung panahon yun, wala kami talagang nakuhang karagdagang training maliban dun sa pagmarcha-marcha. At least nung panahon namin. I don't know nga what you have in mind eh.
Well, itong sa akin naman is, you can call this ROTC, CMT. Siguro ang nabutan mo yung CMT.
CMT at CAT, sir.
Training.
CAT was high school, CMT was college.
CAT was high school, fourth year high school. Then CMT
was 2 years of college.
Second year college. Itong sa akin ngayon, it will cover grades 11 and 12, senior high school. Yan yung ROTC bill ko. Grades 11 and 12. Kasi noon, that is already good as first year and second year college. Yung grades 11 and 12 ngayon ng senior high. And i-correct lang kita dyan na Edno, yung marcha-marcha. Siguro, yun lang ang para sa'yo, yung marcha-marcha ay parang walang kwenta sa'yo yun. Pero alam mo ba na yung disiplina na makukuha mo through following orders dyan sa marcha-marcha ay napakalaki pagdating sa gira? Kaya sabihin mo hindi ka tinuruan paano bumaril, paano makipaglaban sa kalaban just in case magkakaroon ng gira. Pero yung marcha, just to obey commands, disiplina, napakalaking may dulot yan sa atin. Pag gira, pag sinabing forward march, hindi ka nag-forward march, naiwan ka, patay ka. Pag sinabing drop, hindi ka nag-drop, tinamaan ka ng bala. So, napaka-importante po yun, yung marcha-marcha na
yes,
yan.
Sir. I understand naman, sir. Pero the trade-off din kasi there is this eh. Ang commitment ng gobyerno dyan to fund that kind of training is also going to be immense. So, yung trade-off for one to learn that kind of discipline to go marching around versus how much will be spent every year for that kind of a program to be implemented. I think that's also the primary reason why some legislators are not that warm to the idea. Kasi I think even the DND last year was saying na, teka, we can't afford that.
Well, kaya nga, isama natin ito sa ating, gagawa natin ito ng batas para maisama natin sa GAA yung budget para for that purpose. Gagawin natin ang paraan na mapunduhan ito para ma-implement yung program na ito.
Senator,
You know,
Pero yan ba talagang kailangan ngayon, Senator Bato? Dahil alam nyo naman, I mean, the economy is still recovering from the pandemic at talagang the budget is also challenged right now. So do we really need to allocate funds, much needed funds, diba,
Alam mo,
for something like the ROTC?
Alam mo, this ROTC has been there since 1935, yung Commonwealth Act number 1, otherwise known as the National Defense Act of 1935, panahon pa ni President Manuel O.S. Quezon, and the funding was never a question. Yung budget ng ROTC, hindi yun sinasabi na ganun kalaki. Hindi man gaano malaki ang budget nitong ROTC. And yun nga, ayaw natin gumastos. Then, anong gagawin natin just in case may mangyari? God forbids. Tayo in-invade ng China. Sige nga, sino makipaglaban sa kanila after our regular armed forces? Yun na lang. Wala, surrender na lang tayo.
Senator, kasama po natin si Ami Pamintuan ng Philippine Star.
Ami, good evening, Ami.
Good evening, Senator. Sorry, late
Yes.
ako. Meron pa kayong ibang proposal regarding security yung NTF-ELCAC, gusto nyo kamong i-institutionalize. Sabi ni President Marcos, sabi ng Malacanang, gusto ni President Marcos, he wants a stronger and improved NTF-ELCAC. Ano ba exactly yung ibig niyo sabihin? Institutionalizing NTF-ELCAC.
Yung, this is just yung EO70. Basically, EO70 signed by President Duterte. Yun lang ang laman. Instead of task force, gagawin nating National Commission. Noon, National Task Force ELCAC. Ngayon, National Commission na ELCAC. Yun lang, i-institutionalize natin ito para hindi masayang ang gains na nakamit natin sa ating anti-insurgency program. Sayang kung mawala yung momentum. Kailangan i-institutionalize natin ito dahil kahit sino mang uupo na presidente, pag ito'y nasa batas na, tuloy-tuloy na ito. Hindi ito mawawala. And we cannot afford to lose the gains. Alam mo, ang ganda nangyari natin sa bansa natin dahil sa ELCAC. Ang daming nawala, na dismantled ng mga guerrilla fronts ng NPA, ang daming NPA na nag-surrender. Ngayon talagang reduce yung kanilang strength. Bihira ka na makarinig ng atrocities committed by NPA. Dahil nga talagang undaran sila ngayon dahil sa ginagawa ng ating NTF-ELCAC. So para hindi ito maputol, hindi masayang ang momentum, ituloy-tuloy natin ito, gagawa tayo ng legislation na ma-institutionalize itong ELCAC.
Dadagdagan niyo po ba yung members ng task force or yung commission na yan? At saka lalawak ba yung mandate niya? Dadami ba yung powers niya under your proposal?
Wala. Basically the same. Yung anong nakalagay ng EU70, yun lang rin na ilagay natin. The same lang.
Pero paano yung mga concerns naman? Dahil siyempre yung pinakamalaking issue nagre-red tag yung National Task Force yun ang reklamo ng yung mga grupo na yun na nga sinasabi nila. They are unfairly linked to the communist insurgency.
Well, yan, malaking debate yan pagdating sa red tagging dahil it's not the military, it's not the police that red tag these people. It's Juma Sison. Siya mismo ang nagsabi na itong mga organisasyon na ito ay printe ng NPA. Front ito ng CPP-NPA. Si Juma Sison mismo nagsabi. Then bakit tayo sige deny ng deny? Yan ang mahirap. Kaya tumatagal, lumalaki yung problema natin. Deny tayo ng deny sa katotohanan. Totoo yan. Kahit na sabihin nila, deny nila yan, kung sila lang masunod, then lalaki ang problema natin sa insurgency. Kailangan ang gobyerno ang masunod dito sa ating bansa.
Pero sir,
Hindi gobyerno.
Sir, let me just qualify, sir.
Hindi yan term ng kwan.
I saw the interview several times of Joe Masison. He never said that these organizations are fronts of the CVP-NPA. He said they're part of a movement.
Tingnan mo. Mayroong kwan dyan. Merong very clear. Sinabi niya, mga front nila yan. kailangan magsama-sama yan, yung CPP, NPA, NDF, in order to topple the government. Nandun sa video. Baka ibang video yung nakita mo.
But to that point, Senator, yung iba-iba yung nakikita natin, one thing we can all agree on, that was really a concern of people here and all over the country, was also the question of due process. I mean, red tagging not just as a matter of labeling people, but the reality was that people were seeing NTF-ELCAC na parang makapili. Basta binansagan, tapos na yung usapan. You say that dapat manaig dito ang gobyerno, pero hindi po ba dapat ang manaig dito ay ang batas? And the rule of law that's going to be there.
May batas naman tayo sinusunod. Bakit ba pag sinabi pala ng ELCAC na ito ay supporter ng NPA, sinasabi naman ng mga dating NPA na nag-surrender na nandiyan na ngayon sa gobyerno na itong mga grupo na ito ay supporter namin noon, ano masama doon? We are just telling the people because the people are being fed with lies by this organization.
Sir, for example, when Ms. Badoy linked the Angat Buhay program to the NPA, is that, do you think, accurate?
Ano?
When Ms. Badoy linked the Angat Buhay program to the New People's Army, do you think that was accurate?
Mag-present siya ng ebidensya. Pakita niya yung ebidensya niya.
That's the point, Senator. But that's the point, Senator. Hindi po ba that due process works the other way around? Kung sino yung naghuhusga, sino yung nagbibintang, siya ang magpresenta ng ebidensya. Hindi yung mauunang bintang pagkatapos kung sino pinagbintangan. Siya ang hahamunin niya na, di magpresenta ka.
Ay, hindi yung nag-akusa, siya magpresenta. Sinabi mo kaya ni Badoy, hindi yan sasabihin ni Badoy kung wala siyang alam, wala siyang hawak na ebidensya. Hindi yan sasabihin niya.
But that's precisely the problem, sir. But that's precisely the problem. I mean, we're talking about Laurent Badoy specifically. But a lot of personalities that have been implicated in red tagging have basically done that, endangered the lives and welfare of people without presenting evidence. I mean, I'll be honest with you, Senator. I've spoken with military officers who were frustrated, sabi na lang nila, with people at the top. Because, to your point, NTF-ELCAC, in the original conceptualization of it, was really effective on the ground. They were saying, in terms of our relationship with the community,
whole of nation.
All of nation approach, interagency approach, it was really working. Ang sinasabi, ang nakakasira sa amin, mga tao sa taas, iilang tao na ang bilis-bilis gamitin para mag-red tag, and these were military people acknowledging it. And I guess the point, sir, is when you say that you want to institutionalize, beyond institutionalizing, how can you put safeguards and improve? Because hindi naman po kaila sa ating lahat, meron talagang pang-aabuso doon sa kapangyarihan ng NTF-ELCAC and ng iilang tao na mangbansag lang pagkatapos nakompromiso na talaga yung buhay ng mga tao na walang kamuang-muang.
Alam mo, meron man tayong mga batas. Pag sila ay naagrabyado, din magkaso sila, kasuhan nila itong mga nag-red tag sa kanila kung ayaw nila yung red tagging na yan. Basta, this bill, walang provision dito sa bill na aking ginagawa na nagsasabi about red tagging. Walang red tagging dito sa aking proposed bill.
And in fairness, sir, we have to acknowledge that. Wala naman kayo sinasabing illegitimize natin ng red tagging. I think the question is...
Yes.
Exactly. But I think the question for a lot of people is, what can you do to prevent red tagging?
Hindi ko trabaho yan. Trabaho sila dapat para hindi sila mag-red tag. Ayusin nilang ginawa nila. Kasi yung tao na kaya ka na nasabihan na gano'n dahil kayo ginagawa mo yan. Kaya dapat sila ang mag-ayos. Si Juma Sison mismo ang nagsabi sa kanila, nag-red tag sa kanila. Hindi ko problema yan. May mga batas tayo. Sundin ang batas. Pero hindi natin pwedeng sabihin na magpakabulag at pipi at bingi lang tayo dyan sa ginagawang panluloko nila sa ating bayan. Kaya tumagal itong problema sa insurgency dahil dyan sa mga tao na yan na nagsusuporta sa NPA.
Sige, Senator, pahabol ko lang yung isa pa niyong priority bill. the restoration of capital punishment. Yung sa proposal niya, gusto niya for drug traffickers, no? Pero si Senator Bongo gusto yatang isama pati plunder. Kayo ba, pabor ba kayo doon na pati mga corruption cases, plunder cases, isama sa ibang mga offenses siguro? Isasama niyo pa ba yung mga dating capital offenses? Halimbawa, kidnapping for ransom.
Ako, nilimit ko lang talaga yan sa high-level drug trafficking dahil nga alam ko nga hirap makalusot itong death penalty. Kaya high-level drug trafficking lang ako dahil kung sabihin mo nakasama yung mga heinous crimes, maraming nagkukumit ng heinous crimes ng mga mahihirap. So pag sila tinamaan, magiging anti-poor na naman daw itong ating batas na ito dahil ang nabibitay lang yung mga pobre na hindi kaya magdepensa sa sarili nila sa korte. So dito tayo sa high-level drug traffickers dahil wala namang small-time na high-level drug traffickers. Mga multi-millionaires itong mga drug lord na ito. Kaya nilang mag-hire ng mga abogado. So dito lang tayo, dito lang ako. Yung issue naman sa corruption, napakahirap niyan. Dahil to be frank about it, maraming politiko na involved sa corruption. Hindi makalusot yung batas na yan. Sigurado ako. Pag corruption, isama mo dyan, hindi mo. Yung mga korap na politiko dyan, bubuto kaya yan para mabitay sila? Hindi yan bubuto, haharaan sila yung batas na yan.
Yan, agree kami sa inyo dyan. Pero dun sa drug trafficking, ito lang, sa drug trafficking, 6 na taon, yan nga ang priority ni President Duterte. Wala naman tayong nahuhuling malaking isda. Ano bang yung problema natin dito? Wala naman nahuhuling big fish, ika nga. Ang daming napatay na mga small time na mga dealer, pero wala naman nahuling big fish.
Luchi, may mga big fish. Nakita mo ba yung mga inchik na nahuli? Nahuli doon sa... marami tayong mga drug trafficker na inchik na nahuli, ha? Meron tayong nahuli mga big, malalaki. Kaso lang, mas marami talagang nahuli na maliliit dahil lang nga, yung pyramid yung assumption, pyramid yung...
baka sila pa yung masampulan. Hindi naman yung mga malalaki. Yun naman ang fear din ng iba dyan. Kahit na sabihin yung drug trafficking lang ang covered ng bill nyo.
Kaya nga, siguruhin natin na yung high level lang ang tatamaan ng death penalty. Ayaw natin yung mga low level.
Feeling nyo may suporta sa 19th Congress, yung restoration of capital punishment?
Sa 18th Congress, just a background there, 18th Congress, there were 11 death penalty bills pending sa Senado, authored by 9 senators. So 9 kami senator na nag-author doon sa 11 bills na yon. Now, unluckily, all these bills were referred to the Justice Committee chaired by a senator who was anti-death penalty. Kaya kahit isang beses, hindi talaga na-hear itong death penalty bills namin. Kaya ngayon, hopefully, si Senator Francis Tolentino mag-chair ng Justice Committee, sana ma-hear niya itong mga bills na ito. I am optimistic na tatakbo itong mga bills na ito. At least matatakil ito. At kahit na sa committee level man lang.
Ano yung mode of execution na propose niya?
Well, understood naman yun na ang universally accepted na mode of execution is
Lethal injection.
yung lethal injection. Lethal injection.
Senator, huling tanong na lang po. Naaalala ko po dati na interview ko kayo and I asked you if you could do the war on drugs all over again, what will you do? And you said siguro dapat inuna pala natin ang pulis. Dapat inuna natin ang internal cleansing. Apart from that, if you were to give advice to this new government of President Marcos on the war on drugs, ano po ang abiso niyo sa kanila?
Well, initially, nakausap ko na si Secretary Binhor Abalos, isa LG. Sabi ko, sana, ayun lang ang kuwan ko sa kanila, na sana, huwag na makabalik yung mga ninja cops. Dahil yung mga ninja cops na yan, naghihintay lang yan na umalis si President Duterte sa Malacanang at pag-alis si President Duterte, mag-a-apply na naman yan ng reinstatement, makabalik na naman yan sa serbisyo, balik na naman yung problema natin sa droga. Kaya yun ang sabi ko kay Secretary Abalos, sana bantayan ninyo na hindi na makabalik yung mga ninja cops na yan.
Sir, but a quick follow-up doon sa puntong yun. Ibig sabihin niyo po ba that for everything that happened over the past 6 years, in terms of internal cleansing, in terms of addressing the problem of ninja cops, that the outgoing government did not actually do enough to make sure na hindi makakabalik yung mga yon, and now it is the problem of the next government to make sure na hindi makabalik yung mga yon?
Well, alam ninyo, dyan, babalik na naman tayo sa corruption. Babalik na naman tayo sa corruption yan. Maraming pera itong mga ninja cops na ito. Pwede itong magbayad kung anong dapat bayaran para makabalik sa serbisyo. Kaya yun dapat
patients even with the primary vaccine series that yes, I got this COVID, but I only have mild symptoms. So I'll just have to have this primary vaccine and I don't need the booster. So I think there's a communication gap there because what we imply, yes, it is mild because you had the primary, but if you don't want to get sick more, then it's better to get the booster.
What about yung redefining the vaccination, a vaccinated person to include the first booster? Hindi naman siya mandatory, kaya lang maraming mga nagagawa mga fully vaccinated na hindi pwede dun sa unvaccinated, di ba? Pwede ba yun?
Yes.
Kasi sinusuportahan daw yun ni President Marcos, who is currently battling his second bout with COVID, no?
That's the other option, and in fact, that's what Sir Joey Concepcion also advocated previously, even during the time of President Duterte. But again, we haven't run in terms of, there was no advancement in that particular recommendation. But now with the new administration, and I hope the new administration will really accept this type of recommendation, since we are one also that we want more economic activity, more people will be, mobility is important for us, but we need more population to be protected also.
Hindi ba
What will
tumaas
it
yung
take
public?
to make people... Sorry, go ahead, Ami.
Hindi ba tumaas yung public awareness dahil sa nagkasakit uli si President Marcos, second round niya with COVID? Hindi ba tumaas yung interest in getting boosted?
I think, the people will only realize that, okay, let's go back to the Delta. Remember when we have the Delta, and then the vaccine expert panel recommended for the first booster, early part of September. What happened? We had a very good uptake of the booster during that month, no? Because a lot of them experienced that when you have the Delta, you go to the hospital because of the severity of the infection. But it waned down after the January because a lot of those who were infected, the hospitalization rate is not overwhelmed, no? So medyo bumaba na yung booster uptake noon. Until such time na ngayon, na maski meron ng variants of concern, mas mababa na ang booster uptake, medyo tumaas na ng konti, especially when the recommendation for the boosters sa 12 to 17 nag-umpisa na at saka yung sa mga immunocompromised. But for the general population, this is a concern because until now, mukhang hindi ganun kataas ang acceptance sa booster.
But in any case, we're at a point now where positivity rate is at 10.5, and then, the new cases have risen to over 10,000. Pero hindi pa rin nagpapanik ang mga tao. I guess, tanong ko nga sa inyo, is there really something to be afraid of? Kasi ang taas na, and yet, wala naman talagang hindi binababa yung alert, hindi tinataas yung alert level. Kumaga, there are no signals that sort of like warn people na, uy, magpa-booster na kayo malala na ito. Parang walang ganun eh. What do you think will it take?
Ganito yan, Luchi, no? Now, we have already seen a lot of the data, especially with reinfection, getting you more risk for long COVID and complications now. And with breakthrough infections, there's also a possibility of more long COVID. No? Now, the impact of this reinfection and breakthrough infection, hindi pa natin nararamdaman yan. We will only see that 2 to 3 months from now, yung mga na-infect, they will be in the hospital, not because of COVID, but because of the long-term effect of COVID, which will affect the heart, the lungs, and the other organs na baka, at on the hindsight, baka sasabihin natin, nagka-COVID pala to siya noon, sayang naman to, sana nabakuna. Yung mga ganun, no? Because right now, Luchi, we're getting all those small numbers, even with this Omicron, we're getting people that are already having high requirement for high flow or mechanical ventilation in some of the hospitals I'm affiliated. So, hindi pa rin tayo ligtas dito, no? And that's why we're seeing people on the ground having this severe COVID. Maski sasabihin pa nating konti compared to Delta, which is expected, that severe form is not zero even with these new variants.
Sir, I was doing some readings a while ago and I came across RA 10152, yung mandatory vaccination for children of vaccine preventable diseases. So we have had in the past a law that allows for mandatory vaccinations.
Yes, precisely, because children are really high risk for mortality of these vaccine preventable diseases. And it's high time for health experts and policymakers to really give a good look at this on how we can improve our vaccination. And that's why I was telling you, probably the most important pathway, if there is no updated definition of the full vaccination, then let's have it mandatory, especially for the general public to get the first booster.
Okay, Dr. Ronald Solante. Sir, maraming salamat po.
Thank you,
Thank you.
Doctor.
Thank you.
Salamat, Doc.
Now, from new normal to a better normal, a group of experts has drafted a list of COVID-19 exit strategies to help the country transition to normalcy. For details, we have former presidential advisor Joey Concepcion. Welcome back, Mr. Concepcion.
Good evening.
Good evening.
Sir, you've been working with this advisory council of experts. Have you had a chance to present to President Marcos, and what, if any, have you had occasion to outline as your recommendations to the new administration?
Well, in the couple of weeks, we've been really debating with medical advisors. Now, we formed the Advisory Council of Experts, of which Ronald Solante has been part of it, that Rosa, Michael T, and so many of the best doctors who experienced this pandemic, especially in the first 2 years. No? So we've come to certain conclusions, and we've sent our letter to President Marcos on our recommendation, and hoping that he would grant an audience with a group of ACE. No? And Dr. Ronald Solante is correct. No? I mean, you have basically some level of complacency out there right now. But nevertheless, I think we should remain focused on our approach. No? And that's why we have recommended a simplified alert coding, using the stoplight, green, yellow, and red, basically focused on ADAR and HCUR. And these are the base. It simplifies the whole process, whereby greater transparency is seen, why we are in green, why we will be in yellow, and why we are in red. No? So, and these are basically all agreed by the Advisory Council of Experts. So, and there is also a provision where outdoor masking can be lifted, whereby 70% of those who have taken the primary doses, have to have the first booster shot. If we were to look at it where we are right now, we're very far from that. So it's a challenge to really get up to 70% of those who have taken the primary doses to get the first booster shot. And that is very important. Dr. Solante even emphasizes the waning immunity.
Sir, very quick and very basic follow-up by way of giving background also. I don't know if people caught that. ACE is the acronym. It refers to the Advisory Council of Experts. What's the nature of ACE? Is this purely a private sector, civil society?
Yes.
Okay.
So what we did is we got the best doctors who were with us in the pandemic, since we had a public-private partnership, and we worked with Octa Research. We worked with the best doctors out there. Some of them are part of IATF, NTF, and the most important is to prevent lockdowns, no? And that's the private sector's sphere. How do we prevent lockdowns, and how do we manage this? And bottom line is healthcare utilization rate is the most important. So anything above 50% will take you to red, no? Anything below 50% will keep you within green and yellow. So we have to prevent the HCUR from going beyond 50%. Initially, I was saying, why don't we make it 60%? But the doctors were very conservative to keeping it 50%. Because when you see hospitals, people dying, emergency rooms getting full, they don't want to see that happen, no? So this is what we agreed with them. And when the private sector makes recommendations, I felt it's very important to be backed by science, no? And what best is not to get the best out there who have really gone through the battlefield for the last 1 year, 2 years already, and advise the private sector on how we can prevent lockdowns. And this is what we are doing right now.
Mr. Concepcion, you originally recommended the redefinition of a vaccinated person to include the first booster shot. And now Dr. Solante mentioned vaccine complacency. Are you going to push again for this redefinition, or do you have other suggestions to overcome vaccine complacency?
Well, of course, we want to see that the definition of fully vaccinated person includes the primary doses and the first booster shot. No, I think the doctors are unanimous when it comes to this. No, but then again, I mean, we can't implement vaccine mandates because there's no such. Secretary Maynard Guevara at that time said it was not legal to do that, so they abandoned the no vax, no ride, and all of these other things. No, we cannot tell our employees again to take the RT-PCR test at their expense because they're not vaccinated. So yes, complacency is there. Now, we will try to do a campaign in the coming weeks to encourage, but the attention really is towards the LGU, and that's why I've set a meeting with Secretary Alvalos, that how can the private sector partner with the LGUs to really campaign so that our citizens really focus on taking at least one booster shot, not the first booster shot. No? And I think that's what the president wants to see. So our goal is just 70% of those who have taken the primary doses. No? Right now, the number of people that took the primary doses is about 74, 75%. So we're saying let's target 70%. Where are we right now? We're just maybe in the 20% levels. No, I got the table from DOH, and they range between 14. So it's very, very low. So if and then we reward the regions that attain these levels by allowing them to have the removal of face masks on outdoors if they achieve this. But believe me, achieving this is not, it's a tall order. No?
Kasi I imagine that it would be easier now, no? Compared to before when the problem was hesitancy. So maybe it's just a matter of bringing the vaccine talaga closer to the people, no? Because now they're open. It's just that they're busier now. They're back to work. They're traveling. The transport time is just, it just eats up so much of their day, and they're just also recovering from the crisis that individually they suffered from. Isn't it easier to just make it more accessible? After all, if you give it to them now, wala na silang hesitancy. There's so much less fear. At least that's my impression.
That is true. There is less fear because look at the number of deaths. Compared to Delta, Alpha, and Beta, it's very far, no? There's less deaths now. The infections are basically mild. And I have so many people that are getting infected, but they're all mild. No? Unlike previous infections when Delta, Beta, and Alpha were there, people were in ventilators, intubated, and all of that stuff. And people were dying. I had so many friends who passed away. But you don't see that now. So that's what prompted people to take the vaccines much earlier. Now that they're, very clear that Omicron is mild, whether it's BA.5, okay, you can have long COVID and other complications, but that's what the public sees. Now, how do we get them to get boosted, at least with the first dose, without vaccine mandates? And that's why Dr. Solante was saying that maybe it's time to bring in vaccine mandates. But I know that this administration might not push for vaccine mandates, no? Because there are some people who think it's illegal to do it. And we just have to find a way to get it done, no? And I think the LGUs will have to really go down into the people and really convince them to take the booster shot. But in the end, what can you do if they don't really want to do it? Are we going to drag them to the vaccination centers and just jab them? I mean, that may be illegal, no? So locking down, preventing them from entering restaurants, we don't want to do that now because restaurants and business establishments are wanting to generate more mobility so that they can recover from the previous lockdowns, no?
There's a proposal, sir, and no less than President Marcos has said that he wants face-to-face classes to start rolling out by September, hopefully full face-to-face by November. We've had this conversation also with Dr. Solante. Do you think with the children and their parents trooping to schools over the next, by September to November, that poses any risks as well as opportunities for vaccination drives?
There are always risks, no, when you have face-to-face. And my own experience when I traveled to Spain, everything was open, outdoor, and indoor face masks were not needed. So we conformed with the public, and we managed to be safe, no? And I guess in the Philippines, if we want to go to be able to emphasize that, maybe, I don't know legally if we can do it. If you want to go face to face, you have to be vaccinated. So I think the legal experts of the government will have to check if that they can mandate vaccination for those who want face to face. No, so that's something that the Marcos administration will have to look into. And if it is allowed, then that would be fine. No, in other words, face to face, yes, you have to be vaccinated. No.
Would the private sector be willing to continue discounts, for example, for the vaccinated and boosted?
Yeah, I would think so, but the problem really is I don't think that is really the great motivator now for people to get vaccinated. I think fear is the greatest motivator when people want to get vaccinated. And it's really, unless we drag them to the vaccination centers or we have vax mandates. But aside from fear, I don't think these freebies will do anything. I mean, and of course, not many of the business establishments can really afford, because now we're facing high inflation of all our basic raw materials, from chicken shortages to so many other problems that the retailers, the restaurant owners, the manufacturers are facing with the current Ukraine-Russian crisis, which is creating the biggest problem right now, which is high prices.
Sir, pasundot lang, sir. We're going to see a major oil price rollback tonight at midnight, and possibly another set next week. What are the chances that we'll see some adjustments in the prices of commodities?
Well, it's pretty challenging because all of us have to hedge. No, some of us were lucky to hedge at lower prices. So we will keep our prices low. But it's a blend. You've got sugar at 4,000 per bag right now. That's a crazy price for sugar. No, it's the highest price that I've ever seen. So there are certain commodities that are very high, and certain commodities that are starting to taper off. But in the end, you've got electricity costs that will continue to go up. So definitely, there is no escape in this inflation. Now, let's see at the end of the year, if the government starts to increase interest rates, maybe that may temper inflation in this country. There are a lot of headwinds at this point in time. And our biggest challenge as a manufacturer is we cannot pass the prices to the consumers abruptly. We have to do it over a period of time so that consumer spending will not weaken, and that's what we are trying to avoid, especially as we approach the third quarter and leading to the fourth quarter.
Okay. Mr. Joey Concepcion, sir, maraming salamat po.
Thank you, sir.
Thank you,
Thank you.
Mr. Concepcion.
Salamat rin.
Thank you. So,
And that's the Chiefs. We hope what was discussed will keep the conversation going. Mask on, wash hands, stay safe, Philippines. I'm Roby Alampay.
I'm Mami Pamintuan of the Philippine Star.
I'm Luchi Cruz-Valdes, News 5.
I'm Lingao, and we are One News, all sides, all the time.